Dr. Yogita Singh, practicing dermatologist at OnePlus Clinic Noida and Dermawell Clinic at East Delhi. Today I'll be talking about hair fall problem due to COVID infection. As we know, there is a pandemic going on and many of us are facing hair fall related issue due to that. But to understand why this is happening, we need to understand normal hair follicle cycle. The first phase of the cycle is anagen phase, in which there is a growth. This is called as a growth phase. In this, there is a growth of the hair and they increases in length, which is followed by a small transitional involutionary phase called catagen, and then followed by a telogen phase, which is a resting state of a hair follicle cycle. In the telogen phase, the hair stops to grow further and remain as it is in the scalp. After this, our cycle restart and anagen phase starts again, because of which there is a new hair which is formed in anagen phase, and this causes the earlier older telogen hair to fall from the scalp. This constitutes as a normal hair fall. Normally 100 to 150 hair fall is considered to be normal, but more than that, we consider it as a hair loss related problem. So what happens in COVID is there is two factors. There are two main factors for the hair fall issue. One is physical stress, which is caused by virus, and mental stress, which we take during the COVID infection. In COVID infection, there is a decrease of blood flow to the follicles. Why this is happening? Because our body is increasing the blood flow towards our vital organs, which are fighting the infections such as lungs, liver, kidney, etc. And due to this decreased blood flow to the hair follicle, there is premature termination of anagen phase, that is called growth phase, and it falls into the last stage of the hair follicle cycle, that is telogen phase, that is resting phase of our hair cycle. On top of this physical stress, there is another major cause, that is mental stress, which is seen in people having COVID infection, which also contributes to the increase in hair fall. We see this hair fall usually after 2 to 3 months of infection, and it can last up to 6 months. Many of us may not be able to co-associate it with COVID infection as it is happening much later, but the triggering point started when you had COVID infection. Similarly, it can be seen other conditions like other infection and surgery or during pregnancy. We see there is an increase in hair fall 2 to 3 months after the triggering event, and it can also last up to 6 months. This is called telogen effluvium. So we have to understand this is not a permanent hair loss. Every hair which has fallen would come back eventually, and the roots will start to function normally and the cycle will come back to normal. We have to stop taking stress about it and have healthy balanced diet. So stay healthy and happy.